My name is Jessica Leung, and I am a breast imager in Houston, Texas. I have the privilege of chairing the subcommittee for the ACR BI-RADS ultrasound at this time. BI-RADS is Breast Imaging Reporting and Data System, and it is a product of the American College of Radiology. The 6th edition of the BI-RADS lexicon and atlas will be forthcoming in the near future. And we have exciting changes in the ultrasound subsection, along with the other subsections. One of the big events in the ultrasound component is the fact that there will be creation of a new category of breast imaging findings called the non-mass lesion. Now, non-mass is not a new finding in ultrasound at this time per se, because it is very much a part of the breast imaging lexicon as manifested at MRI initially in the form of non-mass enhancement, and also in contrast enhanced mammography in the form of non-mass enhancement. So basically, we're looking and discussing more subtle signs of malignancy that you can see at imaging. And really, when you think about it, all the modalities show this in various forms. That is mammography, ultrasound, and MRI, and contrast enhanced mammography. What we're looking at are lesions that likely grow in more of an infiltrative pattern, perhaps single-cell fouling as opposed to a conglomerate that becomes a mass per se. And while invasive ductal carcinoma is still the most common differential when it comes to a cancer in the breast, you are likely to see ductal carcinoma in situ, DCIS, or invasive lobular carcinoma, disproportionately represented when it comes to these non-mass lesions. Now, the exciting thing about it all is that ultrasound is a modality that you can use to guide imaging, guided biopsy, right? So when you have a non-mass lesion at MRI, a non-mass enhancement at contrast mammography, etc., you can now apply ultrasound, and by creating this category in BI-RADS, hopefully our practitioners will be able to recognize the correlate at ultrasound and therefore perform any necessary biopsy on ultrasound. And as we all know, ultrasound is the most favored, if you will, method to guide a biopsy since it is most accessible, most comfortable for the patient, generally speaking, and least costly for the most part, generally speaking. So it's a good thing. Now, when it comes to likelihood of malignancy, well, that depends on a whole bunch of factors. Primarily imaging, for example, is it a new finding? Is it a finding that's developing or increasing? Also, of course, depends on what the imaging finding looks like. A big component will be the distribution, how it is arrayed within the breast. Segmental has been found to be the most predictive of malignancy, followed by linear. There's a lot of research that still needs to be done, of course, to tell us the more precise and evidence-based approach to what the positive predictive value of these imaging findings are. So we don't know all the answers at this moment, and of course, we eagerly await research results from our colleagues around the world so that we can have universal standards that's applicable to all women and all patients, really, around the world. But for now, we know that segmental distribution is definitely predictive of malignancy, followed by linear, and then I would say followed next by focal. So those will be the distribution terms, along with regional, which would tend to connote a more benign etiology that is, for example, PASH, pseudoangioma stromal hyperplasia. So all that said and done, what does it mean when it comes to the patient? What it means is that we now have more, hopefully in the near future, very evidence-based ways of dealing with these lesions as more research comes in, but now a lexicon of structure that we can evaluate these findings to look for more nuanced cancer. So hopefully we can identify invasive lobular carcinoma when it is earlier stage, and hopefully we can identify DCIS, not just as calcifications and mammography, but with other modalities as well, and primarily when it is a high-grade situation, when it impacts the patient's lives most. So on that note, as a radiologist, I'm very excited about this forthcoming BI-RADS lexicon with the inclusion of non-mass lesion at ultrasound and how that can explain and account and serve as a modality guidance for biopsy of non-mass enhancement at contrast-enhanced mammography and at contrast-enhanced breast MRI, all putting together to improve patient care so that earlier and more subtle cancers can be more easily detected. Thank you very much for listening.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.